Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader is a follower, and the leader is a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty.
With regards to Lara Mott, she is a co-founder of the health tech organisation called Improve Well. She is an experienced executive, having spent years in a variety of senior roles across healthcare, specialist investment, biopharmaceutical, life sciences, consulting, and financial services in a range of businesses. She is a life sciences specialist with a first-class degree in pharmacology from the University of Bristol, and she's also named a rising star amongst top 50 female leaders in the UK healthcare. She is also the first appointed BMJ entrepreneur in residence. We kindly do have Lara Mott here today, who will be sparing her time, talking all about how to lead for change and most importantly, how to pioneer any frontline innovation that you are passionate about. So I'm kindly going to leave it to Lara Mott to guide the talk for us today.
Hello everyone, it is an honour to be invited to speak to you today, and thank you very much for joining this talk on fostering frontline innovation. My name is Lara Mott and I'm the CEO and co-founder of a health tech startup called Improve Well. Here at Improve Well, we work with healthcare organisations across the NHS and internationally to help empower frontline staff to drive change using our digital solution. We have a smartphone app for doctors, nurses, porters, anyone doing the day job to get involved in improving their working environment by sharing real-time feedback. That information comes through to a real-time data dashboard, helping group and organisational leads to understand trends and pressure points in their organisations, and importantly, it helps them to prioritise improvements together. Before co-founding Improve Well nearly 5 years ago with a school friend of mine, Dr. Naeem Ahmed, who is a full-time NHS clinician himself, I spent my career in a variety of roles across biotechnology, healthcare specialist investment, and life sciences consulting businesses. All of these businesses were entrepreneurial in nature. For example, the biotech sector involves bringing novel therapeutic products to market. Healthcare specialist investment firms focus on funding innovative companies to help them achieve their growth goals at a quicker rate than perhaps they would manage if they didn't take that investment and go it alone. And from the discovery of penicillin in 1928 to the structure of DNA in the 1950s, the UK has long been a global leader and innovator of the life sciences industry. I've had the privilege of working with exceptional people throughout my career and truly believe that bringing passionate people together is the secret to innovation, especially in the healthcare sector. But there are always barriers to innovation, from a fear of change to top-down or blame cultures, or simply overwhelming workloads. Sometimes you really just don't know where to start, and sometimes you really cannot afford to get it wrong, again, particularly in healthcare. It's still commonly believed that the best ideas come as some sort of light bulb eureka moment, but that wasn't even the case for Archimedes, even though jumping out of the bath naked and running through the streets of Syracuse makes for excellent storytelling in the discovery of buoyancy, for example. In actual fact, innovation is often a gradual process and requires hard work and a willingness to accept that you're not going to get it right. It means late nights, it means hard graft, and loads of determination. And you might even find that your big idea will never actually get off the ground, which can be heartbreaking. So it's worth bearing the following in mind when it comes to innovation. Roughly 95% of innovative new products fail. Innovation itself doesn't necessarily result in a new product, though. It could simply be a new way of doing things or approaching things or changing the system. Learning what not to do is also part of the innovation journey, and I'll come back to that later. Your innovation itself will change and grow, possibly in directions that you'd never anticipated at the start. Although it's important to bear in mind that change for change's sake can actually be counterproductive. You can never test too much. One of our core values is being evidence-based as a company, and I do believe it does help if it's a team effort. So there's no magic formula, but what we do know is that hierarchical top-down organizations often struggle with innovation. That's because they tend to be kind of slow to react, and often the people who are responsible for innovation are sometimes too far removed from the real problem that needs solving. But don't let me put you off. My whole business model at ImproveWell is based on frontline ideation and feedback, capturing the challenges and frustrations from staff on the ground, as well as new ideas or solutions to address those challenges. Not only helps teams within those hospitals and organizations, it actually also shapes how we evolve our digital solution to meet the needs of our users. We are always learning together, and we've been doing that for nearly 5 years. Genuine, wide-reaching collaboration is not only a democratic concept, but it helps to bed new ideas in more strongly and quickly. If the innovation has come directly from the people who will benefit from it, then the fear of change is as good as eradicated. It's imposed change that people tend to object to. So I believe collective intelligence is about understanding that every point of view adds something important to the process of change, even, as I mentioned earlier, if that something is how not to do it. The potential for innovation is absolutely everywhere in your organization. It's within the living, breathing network of staff, contractors, patients, friends and family, chatting around the dinner table, listening and talking with people at all levels from all backgrounds. It's within that crucible, with all of those ideas in the melting pot, that innovation is actually born. Google's now infamous 20% time policy allows employees to dedicate 20% of their working hours to projects and innovations which they think will most benefit Google. It was through that scheme that a small team of software developers and engineers created Gmail, believe it or not. But it took them 3 years to do that, and the developer had actually been working on the idea for 10 years before that. So far from being a momentary spark of inspiration, innovation tends to have quite a long incubation period. A lot of those ideas stay in the back of people's minds for years. So the challenge that we have is, how do we create an environment in which ideas can have such a long development period? Because it's really hard to go to your boss and say, I've got this magic idea and it's going to be useful to us in about 2031. One of the core principles contributing to the success of Toyota is Kaizen, a philosophy that empowers everyone in their workplace to identify areas for improvement and suggest practical solutions. It also defines the role of management as supporting and encouraging the continual implementation of small adjustments which improve and refine processes. Toyota's huge success has been widely attributed to this way of working, and lots of organizations have applied that to their own industries. Innovation already exists in your organizations. People have already come up with hundreds of micro improvements which make their jobs that little bit easier, or that little bit quicker, or perhaps that little bit more effective, or perhaps makes things really much better for that patient. But without a way of communicating those more widely, without a way of sharing those ideas, considering them with the ideas of others, they never get to reach their potential. They don't get discussed, refined, shared, improved, rubbished, or even rolled out. The technology that we have available to us today, like the internet, social media, smartphones, mobile apps, makes it more possible than ever to create learning environments and build networks quickly with very little expense. People these days are more connected than ever before, and the advancements in science, medicine, and technology absolutely reflect this. So the more we talk, the more we connect, the better our ideas will be, and the faster we'll see improvements occur. In a clinical setting, I believe this means listening to feedback from frontline staff and capturing ideas for improvement that they're already talking about on the lunch breaks or on the way home. Everyone will have a view on how could tomorrow be better, even if it's something small. Helping colleagues to refine and implement their innovations will almost certainly create efficiencies across the system. And every organisation, no matter how well they're performing, wants more cost reductions, increased morale, and improved patient safety. So, what could you do today? Here are a few ideas just to get you started. The old suggestion box for people to give written feedback and suggest ways to improve. You may discover some quick wins here that may not require any financial resource to implement. Sentiment trackers are a very big focus at the moment, particularly given how much pressure the healthcare workforce has been under in this pandemic. Back in 2017, one of our customers, East London NHS Foundation Trust, helped us to design one of our core feedback systems using manual methods. They built a prototype using 2 cardboard boxes and some pieces of paper with a happy or a sad face on them. And they asked people to share whether they'd had a good or a bad day at work and explain some reasons why. This helped team leaders measure and track staff sentiment each week to identify trends and pressure points. Another tried and tested method is to fill a glass jar with marbles, one colour for a good day and one colour for a bad day, and then see the ratios each week. Once you know what works for you, you can perhaps look into digitising the process. Something else that's very popular is daily and weekly huddles, which can help you make a positive start to the day's work and ensure that all colleagues feel involved. That's particularly helpful with big projects or perhaps during handover periods to make sure that nothing has been lost. Innovation hubs are becoming popular, so some organisations create a physical space for people to bring their problems and their solutions to the table, refining them together and hearing the perspective of their colleagues. You can, of course, do this virtually by creating dedicated time to perhaps organising an innovation hub meeting online to tackle some known challenges as a group. Another way of doing this is hackathons. So these are great for tackling known challenges as an organisation. You can run focused campaigns to get people collaborating on solutions to a particular issue, and sometimes a prize for the best solution goes down really well. For example, some funding to get your innovation off the ground. On the subject of prizes, rewards and recognition is important. So simple initiatives like a Star of the Month survey or a thank you initiative can also help to acknowledge the great work that colleagues are doing and encourage more of the same. So it doesn't always have to be about what can we improve. Something might be going very, very well. It's rare that we at Improve Well start working with organisations who haven't already tried some of these methods. We're usually introduced when organisations are keen to capture things digitally. Our solution was born on the front line. So my co-founder, Dr. Naeem Ahmed, was involved in some policy work back in 2013. And a common theme emerging from some key reports was the need to give the frontline workforce a voice. Now a consultant radiologist, Naeem is fully aware of the everyday challenges that staff face. So his own eureka moment was when he was working hard as a junior doctor and thought, why isn't there a junior doctor feedback app? But that was just the start. Since then, we've worked with many hospital teams and departments, not only to hone the solution to their particular needs, but to continuously develop our product so that it can drive real-time insight and innovation whilst remaining simple to use, which is no mean feat for software. The Improve Our solution has 3 core feedback systems. We have an ideas hub for people to share ideas from the small to the large. We have a sentiment tracker that was prototyped by our partner at East London NHS Foundation Trust. And we have a flexible pulse survey module. And the data that we uncover are fed back into a real-time data dashboard in a meaningful, usable way to inform decision-making for group and organisational leads. So we're taking real-world learnings from organisations like Toyota and bringing that power of collective intelligence to the NHS. Over the years, Naeem's idea has evolved into creating the leading engagement solution for improvement in the NHS, helping organisations to create the right environment to improve staff experience and the quality of patient care, which is why everybody is in healthcare. When the pandemic arrived last year, we were privileged to be in a position to support many organisations, including the flagship COVID-19 surge hospitals in London and Cardiff, to listen to their staff 24/7 and facilitate rapid learning in these new ways of working. There is no way that we could have imagined that when we started. If someone had said to me back in 2016, you need to develop a digital solution with the NHS to give everyone a voice, and it needs to be proven and tested to be rapidly deployed in the middle of a pandemic, I would not have known where to start. In fact, I would have probably assumed someone else would be better at doing that because I wasn't exactly qualified back then, and sometimes I still don't feel qualified to do this job. But Improve All has been built by the NHS for the NHS. We did this together. And I personally think that people who work in healthcare are special. They're passionate about caring for people and fixing problems. So our mission is to harness the innovation across a workforce of 1.7 million in the NHS to change the way that care is delivered. And I believe that everybody has a part to play in that. Thank you very much for listening. Hope you've had something new today that you can take away and apply in your own practices. And I'd be delighted to answer any questions that you might have.
Thank you very much, Lara Mott, for sharing a wonderful presentation. So the number one question that I do want to ask you that everybody sort of wants to know is all about fostering frontline innovation. How do you find that courage to do that, especially at a young age, or, you know, especially at a point where your voice may not be amplified? And what tips do you have in order to make something sustainable and to prove that it's actually innovation that is required?
That is an excellent question. What I would say is that you can create the most amazing digital solution in the world with all the bells and whistles, but it won't happen without people. So you can do this without digital technology. As I mentioned earlier, there are a few ideas. I think passion is really key. If you truly believe in something and you think there's a better way of doing it, then you can start by discussing that with your colleagues, get a group of you bought into it, maybe take it to your manager, maybe take it to a monthly improvement meeting that might be going on. You could maybe do some research into your idea, see what's trending on Twitter. Has anybody else in a similar organisation had something similar that they've tried? Because if you can bring the evidence base together or back up your idea with something that you know will help group or organisational leads in your organisation buy into that idea, it's more likely to get off the ground. I think if you work in an organisation that has an improvement culture already, you will find that easy. There will be some improvement colleagues that you can reach out to. Sometimes people have innovation hubs, as I mentioned, so you can go along to the meeting. Or you might just want to get involved in the conversation online. There are online forums. Twitter's quite a good one, but there are online forums on LinkedIn where perhaps you've got peers in other organisations where you can discuss and socialise your ideas. So I think if you are in a position where you've spotted something that could be done differently, I would say just have that passion and that conviction to try as many avenues as possible to get that idea into the conversation so that you can start socializing it and seeing how you can collaborate and take it forward, because somebody may also have a similar idea, or someone might have an idea that's better than yours, and together you can keep that conversation going and make sure it gets to the right people.
Thank you very much, Lara Mott. Now, the second question that I do have is a question that's actually been asked from our organising committee, in particular from our innovation team. So just as a segue from the point that you've just raised, that oftentimes in a culture that's quite innovative, it's very easy to introduce new ideas. Now, we're very much aware that the public sector is sometimes very hesitant to change, in particular in the NHS. So a question which might be very considered well for our organising committee, but also shared with amongst the Healthcare Leadership Academy, whether that's the faculty or the scholars, what particular leadership traits do you feel that you need to have and that you need to develop in order to be seen as an innovator or to be able to propel innovation in a very challenging industry?
Yes, healthcare is a high-risk industry, as we know, and it's highly regulated, and you can't just throw changes out there that might then, cause something else to happen. So, as I mentioned in my talk, there is a fear of, we can't afford to get it wrong. Most organisations will have processes in place to foster innovation, but perhaps you might find yourself in a leadership role where they don't have any processes. Maybe it's your job to start that, and get that off the ground. So I think, as I mentioned, there are forums out there, where you can get involved in the conversation. There's lots of great books that you can read, and obviously online resources. Quality improvement teams are very common across organisations in the NHS. So there's definitely communities out there who are very keen to share best practice and share their journeys in terms of how they got things set up from scratch. I think as a person and the leadership qualities that I would say, I think you have to have patience. Things don't happen overnight. You need to be a team player. Sometimes it's lots of different conversations with lots of different stakeholders. The more multidisciplinary folks that you can get involved in your projects and processes, the better. But that does take time, and it might be that you have to have the same conversation with lots of different people to get that buy-in. So yeah, patience, collaboration, determination, and hopefully being able to just try something, test it, measure it, and then do it again. So one of my tips was, you can never test enough. You hear a lot about quality improvement in the NHS with PDSA cycles, so plan, do, study and act, where you make small changes and then see if they're effective, and make small changes again and see if they're effective. So that there are lots of different improvement methodologies out there. You can find the one that might be appropriate for your organisation. But you won't be alone. There will be like-minded individuals in your organisation that also want to champion change. So I would say, find ways to start the conversation and have that determination that, passionate people can drive improvement, and you don't have to have improvement in your job title to be able to make a difference. Sometimes lots of tiny micro improvements can really add up to make a big impact.
Thank you very much. And the last question that I have before we do open it up to our delegates here today, with regards to your experience being an executive leader and being in executive leadership, what advice would you give for building and developing teams, especially when it comes to undertaking risks? And what are some of the things that you have learnt? What challenges have you faced? And what would you give as advice to anyone that wants to be in that particular position or is developing into that particular role?
I would say communication is key. So I think with any leadership role, particularly bringing people together to drive change, communication is at the heart of everything. So if you can make it clear why you're embarking on a particular project or a particular journey, and bring everybody with you, and then communicate your progress and your milestones, what's working well, what isn't working well, what can be done better. You bring people together on that journey, and if there are bumps in the road, you've got that solid foundation of communication to be able to give people context, learn from it, and decide what you're going to do differently. So I think communication is key. Things things will go wrong. I think with anything, there's always an element of weighing up the sort of risks and rewards and building that evidence base to sort of back up what you're trying to do. Being evidence-based is one of our core values as a business. So everything from a small change in our software to doing something differently with our partner organizations, we always look at, what problem is it that we're trying to solve and how are we going to get there, and what sort of milestones and checkpoints are we going to put in along the way to check that we are actually on track. And again, that comes back to communication. So being open to the journey that you're on and have a plan from start to finish, but be aware that regular check-ins need to happen so that you can look back and think, what's working well, what could be done differently, are we perhaps uncovering something new, and making sure that the changes that you're making have been weighed up. So if it's a small change and there's minimal risk, then great, try it out, see what works. If obviously you are involving something or involving patients or delivering a big project that perhaps requires a bit more of a risk assessment, then make sure that you go through that properly and have a proper rollout plan so that you can make interventions where you need to keep things on course. So I would say communication, planning and regular check-ins to make sure that you are making the right decisions at the right time based on what you're learning.
Thank you very much. That was a very, very good answer to very, very thorough questions. So we are going to open it up to delegates to answer some more questions, but I do want to say thank you again, Lara Mott, for being our keynote speaker for what is our Innovation Day. It's very, very much something that is going to be a highly valued skill for all of the delegates who are going to learn from this particular conference, but also for the forthcoming roundtable discussions and the panel discussions that we have later on today. So thank you again very much, Lara Mott, for being an amazing entrepreneurial and innovative leader within the healthcare system and for doing very well with a very much strong team. If you do want to have any final words that you do want to share to our audience, please do let them know where they could possibly find you, find more information about you, and possibly hopefully reach out for more advice if they want to learn something more in addition.
Absolutely. Thank you so much for inviting me. It's a genuine pleasure to be able to speak to you today. I hope you found it useful. My contact details were on the slide, so you can email me at hello@improvewell.com. I'm on Twitter @improvewellceo. I'm also on LinkedIn, which should just be /Lara Mott. So please do connect. I really do believe in the power of the network and learning from others, and I'm very, very happy to help wherever I can.
Thank you.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA scholar? Thank you for joining us. My name is Johan Marlwana, the Director of the HLA, and it's a good night from all of us.